Piriformis syndrome is a condition in which the piriformis, represented here by this blue theraband, compresses on the sciatic nerve as the sciatic nerve exits through what is called the greater sciatic foramen to go down into the lower extremity. The piriformis muscle itself attaches to the anterior surface of the sacrum from the level of S2 to S4. It comes out through the greater sciatic foramen and it crosses over onto the greater trochanter of the femur, and it lies deep to the gluteus maximus muscle. If the sciatic nerve is compressed by a tight piriformis, that can cause symptoms of sciatica, which could be sensory or motor symptoms down into the lower extremity. And the reason this is important is that could mimic a problem of a lumbar disc, such as a herniated disc or a bulging disc in the lower lumbar spine. The primary joint action of the piriformis muscle is that it pulls on the greater trochanter and it pulls the femur into lateral rotation at the hip joint. If we were in closed chain kinematics, it would pull the pelvis to the opposite side of the body toward the femur. These actions are the actions of the muscle when it's in anatomic position. If we were to actually be in 60 degrees of flexion or more, the piriformis switches its action to become a medial rotator. To assess piriformis syndrome, we could do it by palpating the piriformis, or we could do it by stretching the piriformis and seeing if that tautness caused by stretching it increases pressure on the sciatic nerve. If palpation to the piriformis or stretching the piriformis increases referral symptoms into the lower extremity, that would certainly be a positive sign for piriformis syndrome.